Most people have vision problems. So how do they deal with them? They either wear glasses, or they go to an ophthalmologist and get laser vision correction. Of course, laser vision correction is a good method, but it's definitely expensive, and wearing glasses or contact lenses isn't always convenient. Before you resort to any radical methods, I recommend figuring out the reasons first. Why does vision even get worse? And how can you influence it with exercises? Let's look into the reasons why vision deteriorates. It's the internal structure of the eyeball. Here you can see the cornea, the pupil. This is the lens with its ligaments. And here is the sclera of the eye with the retina and the optic nerve. When light rays pass through the lens, they are focused on the back wall of the retina. And if the rays hit exactly, then we get a clear image. But if these rays don't converge on the retina after passing through the lens, the image becomes blurry. As a result, nearsightedness can occur if the rays are focused in front of the retina, or farsightedness if the rays go beyond the retina. And look, here's the key thing. Who focuses these rays? The lens. And here, a muscle is attached to the lens. Here it is. Here's the lens. Here are the ligaments. And here's the muscle. It's called the ciliary muscle, or the ciliary body. When it contracts, it changes the shape of the lens, because the lens is a kind of liquid, elastic lens that can change its shape. This muscle regulates visual acuity. Can you imagine? And this muscle works together with the extraocular muscles, because the same nerve stimulates both the extraocular muscles and the ciliary muscle. So if the extraocular muscles are tense, then the ciliary muscle will also be in a state of hypertonus, leading to dysfunction. That's why, when tension builds up in the eye socket, and these muscles inside, there can also be problems related to the bones, for example, skull injuries. This can also lead to vision deterioration. So, the muscle inside the eye also doesn't function well. That's why the life hack to preserving your vision for many years is to work with the extraocular muscles and the ciliary muscle inside the eye. And I explain these patterns based on medical anatomy and physiology. I recommend holistic practice that restore energy, rejuvenate your youth, and restore vision on my Mind Body Face platform. So, if you're interested in all of this, follow the link below in the description and join my program. So, the first exercise. We will work with the extraocular muscles. Here they are. You can gently grasp your eyeballs with your fingers, just enough so that your eyeball moves. In other words, you're not shifting the skin, but the eyeball itself. Hold the eyeball and start making gentle circular movements. Try to use your head more, because most people have stiff hands and you might end up pressing too hard. So, after grabbing your eyeballs, start moving them in different directions like this. In other words, you're rotating your eyeballs using your head. This is the first thing you can do, and it's the simplest. Next, you can take your fingers, place them like this, and stretch. This moves the eyeballs to the side. This relaxes these inner straight muscles. So, you place your fingers and stretch them to the sides. And while they're stretched, you can make a gentle vibration to the side. So basically, you're pulling them and making a light vibration. And at the same time, I recommend you breathe. Take a deep breath in and exhale. Breathing really helps relax the tissue. And even better, it helps you focus your attention on the sensation. So don't just use stiff fingers. Try to direct your attention. Feel this muscle as you stretch it. Look, when you move your eyes, you can feel something being stretched inside. Fixate your attention on that. Then keep breathing through this area. Inhale and exhale. And then do a gentle vibration so the muscle can relax. You can simply take it, stretch it to the sides, and tense this muscle by looking at the bridge of your nose for a certain amount of time. And the muscle will start to relax. After that, you work with the upper rectus muscles. To do this, you place your fingers underneath. So, look down and place your fingers on top, above the eye, and sort of move your eye downward. And you might feel that something inside, behind the eye, is stretching. So you place your fingers like this, look down, close your eyes, and also do a very gentle vibration. Your eyes are looking down, and you breathe. Relaxation begins. You just place your fingers and do the vibration. Inhale and exhale, and wait for the relaxation to happen. After that, you work with the inferior rectus muscle, which is necessary. To do this, you look up, place your fingers under your eye, and lift your eyeballs slightly, like this. And you also make these kinds of movements. Breathe in, breathe out. You don't need to press too hard. It shouldn't be very painful. Although, if you have, a lot of tension in your eyeballs, you will actually feel pain. That's a kind of initial effect, but as you relax, the pain will gradually go away. And what else can you do next? You can move your eyes to the right side to work on these lateral muscles. You move them to the side, grab your eyes, and simply shift them to the right. Close your eyes, and I look to the right with my eyes closed. I stretch these muscles, and just do a light vibration and breathe. I breathe until the muscles relax. Then I look to the left and do a light vibration. Inhale, exhale, and you'll feel the relaxation start to happen. So, we've worked the inner straight muscle, the outer, the upper, and the lower. Now, after this, we work directly with the ciliary muscle, the muscle inside the eye. Here's the lens, and here's this muscle. What you need to do is simply press gently on the pupil. Just be careful. You press on the pupil until you feel the first bit of resistance and just hold it in that position. So, you press and hold. When you press, you create a slight tension in the lens, and the ligaments here are also stretched as well. You can press just a little and make a very, very gentle vibration. Just very gentle. If you have high eye pressure, you should not do this technique. If your eye pressure is normal, you can just press slightly on the eye right here. Hold the pressure for 30 seconds. And then release. You can press and make a light vibration, literally just a few grams of pressure. A gentle vibration with just a few grams of force. And breathe in, breathe out. This vibration is super gentle, So you press and just barely move, or just press lightly. That means you're pressing on the lens, on this area. With this light vibration, you stimulate the relaxation of this muscle. And don't forget to keep breathing. Contraindications are high blood pressure and glaucoma. So in these cases, you shouldn't do it. Also, if there's a retinal detachment or something like that. In all other cases, on the contrary, this will be effective. And you'll notice that at first the image might be blurry. But if you keep doing it, you'll see that your visual acuity will improve. I recommend doing it. This kind of exercise should be done regularly. It's also best to finish with this circular motion at the end, just to give your eyes a little stretch. So, here you have a whole set of exercises for your eyes. I recommend you do this exercise every day, just for a few minutes. The main thing is not to overdo it. Don't do it if it hurts. It's best to do it mindfully. That is, really focusing on the sensation. And with each breath, you work through every muscle. But you'll spend about a minute on each muscle. Maybe 2, for example. And then for the ciliary muscle, add another couple of minutes. So in 5 to 7 to 10 minutes, you can do a whole routine. And you can do this every day. There shouldn't be any pain, so don't overdo it. This was Dr. Alice with you. On this channel, I talk about everything related to health and rejuvenation, and how to work holistically to restore your health. So give it a like, subscribe, and see you next time.